Did you know that who had positive self-perceptions of aging when they were 50 had better health during 2 decades of follow-up and lived, on average, 7.5 years longer than those who had negative self-perceptions at the age of 50? Is pain a natural part of aging? Does toughing it out make pain more tolerable? It truly tugs at my heart when I hear older individuals say things like, "Oh, it's just old age pain. Nothing to be done." Or, "I don't want to bother my doctor. They'll just say it's arthritis and give me strong pills." And the saddest one of all, "I just have to put up with it. There's no way to control it." These statements are so far from the truth. They're harmful myths that, unfortunately, many people believe. And yes, sadly, some healthcare professionals might also hold on to these outdated notions. Today, I want to specifically address pain in our older adult population, debunk some of these common myths about chronic pain in seniors, and hopefully leave you and them with a much more hopeful and optimistic perspective. Older adults absolutely do not need to be stoic and simply endure pain. Stoicism, that ability to bear pain or hardship without showing feelings or complaining, shouldn't be the expectation for our seniors. Let's really talk about pain in older adults today and set the record straight. Myth number 1: experiencing pain is a natural part of growing old. The reality is, while it's true that pain often accompanies many of the illnesses that are more common in older age, such as osteoarthritis, various forms of arthritis, cancer, or the lingering effects of past injuries, the pain itself isn't simply a result of getting older. It's a consequence of these underlying diseases, illnesses, or injuries, and these absolutely need to be treated or managed effectively. If we fall into the trap of thinking pain is just a natural part of aging, we become less likely to seek out and provide effective treatments. Persistent pain, at any age, needs to be addressed and managed appropriately, regardless of how old someone is. Myth number 2: older adults suffer less than younger persons when they have pain problems. This is simply not true. The fact is, older adults are just as likely to be significantly affected by pain as younger individuals. In some cases, they might even experience pain more intensely, or be more impacted by it due to other coexisting health conditions or reduced physical reserves. Pain is a universal human experience and doesn't discriminate based on age. Myth number 3: I don't have the right to ask questions about my pain. Absolutely wrong. You have every right to information regarding your pain, what might be causing it, what the treatment options are, and what you can expect. You are a partner in your healthcare, and open communication with your physician is essential. Don't ever feel like you're bothering your doctor by asking questions about your pain and exploring different treatment approaches. Myth number 4: older adults can't tolerate strong painkillers. While it's true that older adults might be more susceptible to certain side effects of medications, including strong painkillers like opioids, narcotic analgesics such as hydromorphone, oxycodone, fentanyl, etc., this doesn't mean they can't tolerate them at all. When prescribed appropriately, with careful consideration of other health conditions and potential drug interactions, opioids can be a valuable tool in managing severe pain in older adults. The key is careful assessment, starting with low doses, and close monitoring by a healthcare professional experienced in treating pain in this population. Myth number 5: analgesic pills or painkillers are the only means of treating pain. This is a very limiting and incorrect belief. Taking pain pills is just one strategy in a comprehensive pain management plan. As I'll discuss further in this video, there are many other effective options available, some of which might even be more beneficial and have fewer side effects than relying solely on pills, especially in the long term. The truth of the matter is that pain affects a significant majority, more than 50%, of older adults. And unfortunately, many doctors and nurses haven't received adequate training in how to properly assess pain in older individuals, how to ask the right questions to understand their pain experience, and how to implement the most effective treatment strategies. This lack of confidence and training can lead some clinicians to feel uncomfortable tackling the problem, and they might avoid asking detailed questions if they don't know what to do with the answers. This can create a situation where older adults, sensing this discomfort or believing the myths we've discussed, also avoid talking about their pain. But pain doesn't magically disappear just because it's not discussed. In fact, if pain isn't addressed early on, the problem can often worsen over time, leading to a cascade of negative consequences. For example, untreated back pain might cause someone to avoid walking and become sedentary, which can then accelerate bone loss, osteoporosis, increasing the risk of fractures and further exacerbating the pain. Before I continue, I want to reiterate that this video is for educational purposes only. For any individual diagnosis and treatment plan, please consult with your own doctor. And if you are experiencing a medical emergency, please go to the nearest emergency department or call your local emergency number. I understand that seniors often have multiple health issues to discuss with their doctors during appointments, and they have many important health concerns they want to address, like heart problems, cancer screenings, or cognitive changes. However, pain is also a serious health issue that must be brought up and actively addressed during these appointments. When pain is poorly assessed and inadequately treated, it can lead to a significant decline in quality of life, causing both physical and emotional suffering. It's crucial to remember that pain is a complex experience that involves not only the physical sensations in the body, but also our emotions, our sleep patterns, our mood, and our overall enjoyment of life. Because pain has such a broad impact on our lives, a multidimensional approach to treatment is often the most effective, especially for chronic pain. I often refer to this as the 5 M's for chronic pain management. People living with persistent pain need to have a variety of tools in their toolbox and learn when and how to use each tool effectively. Pills or medications are just one of these tools. That's the first M. There are various types of medications we use for pain. I've discussed anti-inflammatory drugs in another video. There are also other types of oral medications, including vitamins and supplements. I often recommend vitamin D supplementation to almost all of my patients, and you can find a video I made specifically about vitamin D on my channel. There are other supplements that might be indicated for certain types of pain as well. You can also check out my videos on magnesium, vitamin B12, curcumin, coenzyme Q10, omega-3 fatty acids, and glucosamine and chondroitin to learn more about their potential roles in pain management. Then, of course, there are the stronger prescription pain medications we mentioned earlier, like opioids, as well as other classes of medications that can be helpful for chronic pain, such as certain antidepressants and anticonvulsants. The second M stands for mind-body therapies. I've emphasized in other videos how incredibly important these interventions are for addressing the pain system itself. If the pain system becomes overactive, it's like the volume of pain is turned up, and mind-body therapies can work to reduce this pain volume and even the memory of pain in the nervous system. Interestingly, a significant majority of older adults with chronic pain do not seek treatment with psychologists or other mental health professionals, which is a missed opportunity. One very effective type of psychological intervention is cognitive behavioral therapy, CBT. This type of therapy has been shown to be very helpful for managing pain in people of all age groups by addressing thoughts, feelings, and behaviors related to pain. The third M is for movement or exercise. Exercise is absolutely essential in the treatment of chronic pain. In fact, there's a wealth of high-quality evidence from scientific studies showing that the benefits of exercise for pain can be equal to or even greater than those of medications. And not only that, but the effects of exercise tend to last much longer. If you take a pain pill, the relief might only last for a few hours. But when you exercise, while your muscles might feel a bit sore initially, which is normal and okay. The benefits in terms of pain reduction, improved function, and overall well-being can last for days, weeks, or even months with consistent effort. The fourth M is for modalities. These can include physical modalities, like applying heat or cold packs, acupuncture, laser therapy, or electrotherapies such as TENS. The fifth M is for manual therapies, which involve hands-on treatments like massage, manipulation, and mobilization techniques performed by trained therapists. Beyond the 5 M's, there are also other important tools in the pain management toolbox. One of these is injections or interventional pain procedures. This can include steroid injections into joints or around nerves, trigger point injections into tight muscles, or nerve blocks to temporarily reduce pain signals. And finally, there's surgery, which might be considered in some specific cases, such as joint replacement surgery for severe osteoarthritis, like knee or hip replacement, spinal decompression surgery for spinal stenosis, or even more advanced therapies, like the implantation of a spinal cord stimulator for certain types of chronic nerve pain. So, if you are a senior who is suffering from chronic, ongoing, persistent pain, please talk to your doctor about it. Don't accept the myth that it's just part of getting old. If your doctor doesn't have the resources or expertise to help you manage your pain effectively, don't hesitate to ask for a referral to a multidisciplinary pain clinic. These clinics bring together a variety of healthcare professionals, including nurses, social workers, psychologists, physiotherapists, occupational therapists, pharmacists, and physicians, all working together to provide comprehensive pain care. Remember, pain is not a natural part of aging. When a child experiences pain, parents will do everything they can to find the cause and treatment for their child's suffering. It shouldn't be any different just because you are a senior. We have so many strategies available to reduce pain, and it's simply unfair for older adults to be denied access to these interventions based solely on their age. Thank you so much for watching. Please share this video with any seniors you know who might be struggling with pain. Goodbye for now.